Yes, but she's warm and real. She's a nurse.
But what about Mrs. Peters? She is being pushed around a bit.
She was. I think Susan caught on to quite a lot this afternoon.
She's still out to do or die.
Yes, and she'll go on making mistakes. You know it, and I do. But 1, they won't be very serious mistakes. 2, she can't learn without making them. And 3, she's upset about the case. A good sign, especially when it means she'll be coming to see you quite often.
That's just what I mean. I'm not sure
I am. I'll see you on the 18th. I want to hear how it turns out.
Bye.
By now, the case had become a challenge. Eager beaver, I went out to attack.
No, really, go ahead and finish up. I know how it is. There's so much to be done.
It was really awful of me day before yesterday, barging in on you just when you want to get your husband's supper. I'm sorry, really I am.
Oh, it's all right. I'll have these dried in just a minute.
Now, take your time. It's just that I was so anxious to see you come back to clinic. I'm afraid I wasn't very thoughtful.
I know, it's all right. I'm sorry. I couldn't help thinking about you, alone out here all day. And now that you're going to have a baby, maybe you're a little worried about it.
Is that it, you think?
I don't know.
Mrs. Peters, do you think you feel afraid of having a baby?
Maybe a little.
You haven't told your husband about it yet, have you?
Yes, I told him. I told him right away when I was sure. You did? Really? But I don't think it was a very good idea.
Why not?
He doesn't want a baby. Are you sure? Did he say so? No, not exactly, but I know.
Oh, I'm sorry, Mrs. Peters. Really, I am. Here, now, don't cry. Maybe you're just jumping to conclusions. Men don't always understand these things at first. Perhaps if I talk to him.
No, I don't think so. It wouldn't do any good. You don't know.
Know what? Mrs. Peters, sit down over here with me a minute. Tell me what I don't know.
Well, I'll try. You see, it's not simple. That's why I didn't tell you before. You see, this isn't the first time I've expected a baby.
Oh.
And the last time, everything went wrong. Jack was all excited at first. He seemed to want the baby more than I did, if anybody could. He got another job in his spare time. He helped around the house. It was wonderful. And then I got sicker and sicker, and then, almost at the end of the 9th month, the baby was born dead. You'd think it was the end of the world for Jack. For weeks we could hardly talk at all, and since then we never talk about babies.
But that doesn't mean he doesn't want one.
Oh, but he doesn't. When other people talk about children, he gets mad and shuts up like a clam. Almost a year ago, I kind of asked him about our having one, and again for a week he was all upset. It's no use. It's just no use.
Well, maybe you're right. But does that mean he can't change?
You don't know Jack. He's not the kind to change.
Well, let's not worry about that now. This thing is going to happen whether your husband approves or not.
Maybe when the baby's born, Jack will see.
Of course he will. And in the meantime, you should stop worrying about him and start taking care of yourself. You will come to clinic tomorrow at 3?
I guess so.
Please, Mrs. Peters, I really understand now, and I'm sure I can help you. We'll do this thing together, you and I. And there she was at 3 the next day. I was so happy. And remember how dead set she was against coming? Last week I was absolutely sure I couldn't do a thing. Now everything has changed. It's really wonderful. Don't you think so?
Mm-hmm.
Except...
Yes?
Well, there's just one thing. After all, the most important fact, of course, is that Mrs. Peters is coming here. Without that, we couldn't do a thing. But? Well, this may sound silly, but I don't think Mrs. Peters is nearly as happy about all this as I am. I saw her several minutes after her examination, and she sort of broke down again and cried. Even after Dr. Martin told her everything was going fine.
Well, that's not so strange, considering her previous resistance.
I think there's something else wrong, something really wrong that we're not touching.
Like what?
Well, I think she's coming to like me, to trust me. But it's as though that weren't enough. There's something I'm not doing. Wish I knew what it was.
Maybe it's not you. The one who isn't doing, I mean.
I don't understand.
Well, you seem to have been doing a great deal. I'm sure Mrs. Peters feels your support and your acceptance, or she wouldn't have come here.
Then what's wrong?
There are very few women who can face the fact of approaching childbirth without a great need for reassurance and support. But they need that reassurance from a special person. Having a baby is a job for two people, in more than just the biological sense. Don't you think perhaps that the one who isn't doing enough, as you put it, is Mr. Peters and not you? As a matter of fact, maybe you're doing a little too much. Maybe you're going a little too far in helping Mrs. Peters do without her husband. That baby is going to be a lot of years growing up. Husband isn't a bad person to have around.
But he's impossible. He refuses to accept reality.
Are you sure?
That's what I gather. He refuses to talk to me.
Well, have you tried talking to him?
Well, my chance came by luck, more or less, the following week. I'd put my name on the list for field duty with the mobile unit that was x-raying miners at that time. I was sure it was a chance to visit a real mine, and Miss Roberts thought it was good for me to see the TB control program at first hand. And I must admit I enjoyed the change. The x-ray unit was a beauty. But when we got there, I immediately realized this was the place where Mrs. Peters' husband worked, a coal mine called Flower Hill. He wasn't around, and I wondered if I did meet him, should I talk to him. You see, I hadn't cleared with Mrs. Peters. First chance I got, I looked to see if his name was on the appointment list. Meantime, trying to decide what to say to him. I'm not sure whether I was disappointed or pleased not to find it. At least the problem didn't have to be solved now. Well, there was plenty to do when we worked through the morning. Must have handled more than 30 an hour. And each one had to be told it wouldn't hurt. Those big, tough miners. I never did find Mr. Peters. He found me.
Excuse me, miss. You remember me? I'm Peters. You were at my house a couple of weeks ago.
Of course I remember you, Mr. Peters. I'm glad to see you.
Excuse me for talking to you now, but I figured it was better to grab a chance than to lose it altogether.
What do you mean?
Well, that evening when you were over, I'd had a bad day here at the mine, and I was kind of beat when I got home. Mrs. Peters, all upset and worried. Well, I guess I wasn't very polite. I'm sorry I acted that way. I didn't mean nothing personal. No kidding.
There's nothing to be sorry about. Stand completely. There's nothing to apologize about. How's your wife?
Oh, about the same, thanks. Pretty good. Well, thanks again for taking it like that. I guess I better not interrupt you anymore.
Oh, by the way, Mr. Peters, if you have another minute, I'd like to talk to you.
Well, sure, I got a minute. It's 15 minutes before the whistle.
Well, then, let's go into the infirmary. I won't keep you long. There's something that's been bothering me, too. And I'd like to take this opportunity to talk to you about it.
Well, sure, what is it?
Well, as a matter of fact, it's a rather personal matter about your wife. We were looking over her medical history and came across this trouble she had 3 years ago. You know, the time she was going to have a baby. Mrs. Peters seems to have forgotten a number of the details about her accident, and Dr. Kenyon, who treated her, is dead now. I thought you just might be able to help me.
I don't know anything.
I thought you might remember when she began to get sick.
I can't remember.
That's too bad. I was hoping you could help us. You see, now that Mrs.
We can't have babies. The babies are born dead.
No, Mr. Peters. I think you just don't understand. Dr. Martin says that you and Mrs. Peters can have babies. As a matter of fact, you're going to have one right now.
No, not us.
But really, Dr. Martin has examined your wife very carefully. Mrs. Peters is going to have a baby. And from everything we know, without much trouble.
Doc Kenyon said no.
I think Dr. Kenyon meant that Mrs. Peters couldn't have that baby. Not that she could never have babies. Sometimes the first one is harder, you know. But that doesn't mean she can never have them.
Are you sure? You're not just telling me this.
No, Mr. Peters. Everything points to a safe delivery.
But what about her? Last time Doc Kenyon said she nearly died. I was lucky, he said.
There haven't been any complications this time. Why do you think she's in danger?
I thought we couldn't have a baby. That's what I thought. All these years, I thought something was wrong. Maybe me, maybe my wife. Doesn't make any difference who if something's wrong.
Mm-hmm.
I mean, if she died and it was because she was sick inside or something, it'd be my fault. And that's too big a chance to take.
But Mrs. Peters is in fine shape.
It's hard for me to believe. Miss... I don't even know your name.
I'm Susan Burke.
Miss Burke, you don't know the kind of news you're telling me. I don't know why. I wanted that baby more than anything else in the world, and when that happened, I just kind of never got over it. I got tied up. I got mad every time I thought about it. Maybe it's because I thought never. Maybe because I was afraid Mary would die. I don't know. I can't talk to you about it anymore.
I understand. It isn't important to talk to me. But I do hope you can talk to Mrs. Peters. We can do a lot to help her. But she needs you. She's a little scared about all this, too, you know.
Yeah, I know.
Soon after that, Mrs. Peters started attending our classes for expectant mothers. I'd been informed of her coming, of course, but I'd been out with the mobile unit for 2 weeks. And then I was busy catching up on my work. So it was 3 weeks, actually, before we met face to face again.
Oh, Miss Burke, I'm so glad to see you.
Hello, Mrs. Peters.
I've been wanting to tell you the news. It's so wonderful. I've been wrong about Jack. He wants a baby. He's crazy about it now.
I'm not surprised.
Everything in the house seemed changed last night. It was like when we first came to live there when we got married. We talked about having children, and Jack was kind of grumbling, but not at all like he has been. And when I mentioned picking a name for this one, he got all funny again, you know, all tight and not talking, but it won't last. I know it won't. Something has happened to him.
I'm glad, Mrs. Peters.
But it's you I have to thank for everything.
Not quite. We did have a bad time for a while. But later, all I did was clear up a serious misunderstanding. You and Mr. Peters wanted the same thing all the time. You just didn't know it. It was a boy, that first Peters child. A fine, lively youngster. Hardly ever see him anymore. He's outgrown well baby. But there are plenty of new ones to take his place. Sure, science is the important thing. But the doctors all know that you can't just stick to the numbers when you're dealing with people. They see quite a lot when they listen through a stethoscope. I learned way back on the Peters case, and I still learn it every time I go on duty. It's mighty hard to weigh or calculate the fears and tensions that are hidden in the human beings I deal with. I just try to remember every minute, every second, that feelings are facts too.